Good morning, everyone. I am Press Secretary Philomena Robertson. Thank you so much for joining us for this week's post-cabinet press briefing. We have a very packed morning for you. Of course, we'll bring you a COVID-19 update. You are well aware of what the situation is in the country. We have a series of health officials here to talk to you this morning. But first of all, we will go over to the Ministry of Finance to learn about the upcoming launch of the COVID-19 Economic Stimulus Support Program. With me this morning is the Strategic Program Manager in the Department of Inland Revenue, Ms. Chanel Andrews. Chanel, good morning to you.
Good morning to you and good morning to our viewers and listeners.
Welcome, Chanel. So tomorrow we will be seeing the launch of the COVID-19 Stimulus Support Program 2.0. What's in store for Grenadians as part of this package? Can you give us some insight ahead of the launch?
Okay, so tomorrow we will be launching the second phase of the Government of Grenada COVID Economic Support Program, and it is geared to target the vulnerable population affected by the COVID-19 pandemic in the state of Grenada, Carriacou, and Petit Martinique. This program is much broader than the previous program, which was launched last year, and it would cover I don't want to say sectors because we are not targeting sectors this time, but more vulnerable businesses and individuals affected by the pandemic. The government of Grenada has launched a 36 million dollars, package that would cover businesses can benefit from the COVID-19 fund, COVID support fund from the GD implemented by the Grenada Development Bank in the amount of $12 million. We also will be extending the seed program that is targeted to vulnerable population through cash transfers, and that is in the amount of 24 million. There would be support for the youth expansion program, entrepreneurship program. We're going to be working together with the National Insurance Scheme to provide unemployment benefit program as well. There would be support for both formal and informal sector. As you know, the previous program targeted persons who are registered with the Inland Revenue Division, the National Insurance Schemes, and these persons basically fell under the formal sector. So this time we are also targeting the informal sector as well. And we are also providing internet support, through the internet connectivity program as well to vulnerable households and a lot of other areas. What I can encourage persons to please tune in tomorrow to the launch of the program. We will be reinstating the CES, which is the COVID Economic Support Secretariat, and this office will be responsible for both implementation and coordination of all the programs administered under that stimulus package. We have a new location. We are moving away from the Ministry of Finance building to adhere to some of the COVID-19 protocols that is in place by the Ministry of Health. So we have a new location at the National Stadium, and more information will be provided tomorrow at the launch.
Chanel, before you go, just tell us about the volume of work that has been involved in putting this second program together for the benefit of Grenadians.
Okay, so the Ministry of Finance has been intimately involved in a lot of research. We have a policy unit that has supported us in looking at the economic background, looking at who are really affected by this pandemic. It's different from last year because we were just responding when the pandemic just hit Grenada. But now we have more data. We know we have more information on who is really vulnerable and ways we can help. As you know, school, for instance, is now online in most instances for the students, and some of the families cannot afford to pay for internet. So that was one area that was highlighted as a great need. So we are focusing more on the need for the society at present and who are really affected by the pandemic, who are vulnerable, rather than just targeting stakeholder sectors.
Right, and the inclusion of internet service providers, it demonstrates, it further demonstrates government's collaborative approach to managing the affairs of the country. The Prime Minister has often spoken about this, and the fact that we are now in partnership with a company to actually support the people of Grenada, that further indicates government's collaborative agenda.
Yes, we are working with the numerous stakeholders, other ministries, for example, the Ministry of Social Development, in terms of the seed. So it's no longer just the Ministry of Finance, just doing research and just disbursing monies, but we are working with all the relevant stakeholders. They are supporting us in this initiative, and we hope to target all the vulnerable persons located in Grenada, Carriacou, and PT Martinique.
Okay, and finally, before you go now, the launch is tomorrow. You want to give us a quick sense of what the agenda for the launch will look like?
Yes, the Minister of Finance will be making a public announcement and providing more details along with the Permanent Secretary of the Ministry of Finance and other stakeholders on the criteria for qualifying on those components that I highlighted. They will be highlighting all the components of the program that the program would cover, how much monies would be allocated. We'd also be putting out more information on how persons can apply under the stimulus packages and where you can apply, where the office would be located. All these information would be provided tomorrow. So I'm inviting persons to get the information firsthand for yourself, and we'd also be unveiling our hotline numbers that you can call for further information.
Thank you very much, Chanel, for your presence here this morning and for giving us some insight ahead of the launch of the program tomorrow. So there you have it, ladies and gentlemen. That was Ms. Chanel Andrews, Strategic Program Manager in the Internal Revenue Department in the Ministry of Finance, speaking on the imminent launch tomorrow of government's second economic stimulus support program that has come about because of the widespread impact of the COVID-19 pandemic. At this point, we are going to move on over to the subject of health. The COVID-19 pandemic has preoccupied our minds, our beings, our lives for the last year and a half. And here in Grenada, more so in recent weeks with the current spike in cases that we are experiencing, it is a subject that is even more at the forefront of our minds, and health officials, they have been working around the clock to help manage and control this situation here in Grenada. So there's a very high-powered health team here with me this morning. I have the support of two ladies and, of course, the Minister of Health. So just to introduce the health panel now, there is the Minister of Health, Honorable Nicholas Steele. I also have with me the Acting Medical Director, Dr. Tahisha Donald, and thank you very much, Minister, and the Senior Medical Officer, Dr. Mayana Charles. Welcome to one and all. Dr. Charles, I think you have been elected to start the ball rolling this morning. Please go ahead with your opening statement.
Thank you, and a pleasant good morning to the panel, the listeners and the viewers. By way of an update, Grenada to date has recorded 461 confirmed cases of COVID-19. Of that 461, 193 persons have recovered, and we have 267 active cases. Now, I would like to spend a bit of time here to give you a breakdown of the active cases. Of the 267 active cases, 257 are local cases, right? In terms of the gender distribution, 49% are males and 51% are females. In terms of the age range of the active cases presently, that age range is 5 months to 97 years. As it relates to the vaccination status of the active cases, 83% of the active cases are not vaccinated, and 17% are vaccinated. Right? Now, moving on, we have had 104 new cases. We have had 16 cumulative hospitalized cases, and we currently have 6 persons hospitalized for COVID-19. There are 267 persons in isolation and 540 persons in quarantine facilities throughout the island. To date, we have conducted 59,229 RT-PCR tests. And to date, we have vaccinated 24,977 with at least the first dose of either AstraZeneca or Pfizer, and 18,824 persons are fully vaccinated. And by that I mean they have received both doses of a 2-dose regimen. All right. Now, these are the figures we have for today, and this is where we are. The situation is serious. It is very dire what is happening in the country. Additionally, what we've seen is that our positivity rates, and by that I mean, of all the tests we conduct, how many cases will show positive? A few days ago, that rate was 3%. Today, we are at 11%. What does that mean? A few days ago, health officials will have to conduct at least 33 tests before they get a positive case. Today, we only conduct about 10 tests before we can see one positive case. So the situation is very, very serious, and we need to take heed. We need to remember the core public health preventative measures. We need to wear our mask, but it's not only about wearing the mask, but wearing the mask properly to cover your nose and your mouth. Social distancing, very important. Sanitizing, avoiding crowded spaces. All of those things, right now, more than ever, we need the general public to take heed and practice those measures. Additionally, I reported the figures. 83% of the persons who have been infected, right, of that active case, have not been vaccinated. So what do we see here? We see that the vaccination is working, right? Now, additionally, I want to encourage persons to go out there and get vaccinated. Vaccination, again, is a preventative measure, right? Vaccination prevents hospitalization, severe illness, and death, which is extremely important, right? Vaccines are available, right? So again, to the general public, go out there and get vaccinated. Thank you.
Thank you very much, Dr. Mayana Charles, for painting that very bleak picture of what we currently face here in Grenada. I hope our listening and viewing audience have heard the appeal of Dr. Charles, the fact that our positivity rate has significantly increased, and that we should all be bearing some personal responsibility in all of this to adhere to the protocols and do the things that are recommended and can in fact help to stem the flow, the spread of the COVID-19 pandemic here in Grenada. Dr. Donnell, it's over to you now. You are the acting medical director at the General Hospital. What can you tell us this morning?
So good morning to the panel, good morning to the media and listeners all. Today I would speak a little bit about hospital services and the patients that we have admitted currently. First, I would say that we had our second COVID-19 death last night. Now, this patient was a 59-year-old who was admitted with comorbidities. She had diabetes, hypertension, kidney failure, and diabetic ketoacidosis, along with severe COVID-19 pneumonia. We are sorry to say that, despite all measures taken, despite doing full treatment, and despite doing our due diligence, this patient passed. We want to extend condolences to her family and to her friends, her loved ones, and we are really sorry for your loss. And we would like to just extend our condolences on behalf of ourselves, the medical team, and by extension, the Ministry of Health. Apart from the death we had last night, we have a total of 6 admitted patients presently. Of the 6 admitted patients, their age ranges from the age of 50 all the way up to 97 years old. Of all the patients admitted, we have noted that they all have underlying conditions, including diabetes, hypertension, chronic kidney disease, congestive heart failure, confusion state, but all of these patients have underlying disease. And one of the things we want to take note of is that they are all unvaccinated patients. To date, of the 6 patients admitted, we have 2 of these patients who are critically ill. The other 4 patients, they are ill but stable. We are continuing to use our treatment protocol that was outlined last year in the midst of our COVID-19 pandemic when we had the first cases reported. Our treatment protocol includes vitamin C supplement, zinc supplement, dexamethasone for chronic or persons with respiratory problems, azithromycin and ceftriaxone to cover for community-acquired pneumonia, and of course to treat the underlying conditions, for example, diabetes, hypertension, and any other underlying condition we treat with the necessary medication. So this is a treatment protocol that we've been using. We also use the prone position to assist patients with their respiratory effort. And prone position means placing patients face down to assist in their breathing. So this is a treatment protocol that we are using. In terms of hospital services, we have made some changes given the state of our outbreak right now. And we just wanted to reiterate to the public what is expected on your part and what would be happening at the hospital. First of all, because of the outbreak, we wish to decrease the number of persons coming into hospital that is really not necessary. So as a result of the current status of our numbers, the figures that we reported today, 104 new cases, we have decided that we want to stop visitation to the hospital services. This is in an effort to decrease the chances of persons bringing COVID-19 into our hospital service. Persons who have to visit will be expected to subject to an antigen test on arrival at the hospital. So we just want persons to know that, of course, there are persons who will need to visit. You can drop off your stuff, and persons who really need to be at the bedside will be subjected to an antigen test prior to your entry into the hospital. If your test is positive, you will not be allowed to enter. If your test is negative, you will be allowed to enter, and of course, following the protocols established. Mandatory wearing of face mask, hand sanitizing, and maintaining distance as far as is possible. We want to give you a little update on the preparation of the hospital outside of that. Now, in preparation for this outbreak, currently we have 11 beds that are currently ready to house COVID-19 patients. We also have 13 beds as backup in case it extends beyond the 11 beds. In terms of ventilators, we have 18 ventilators currently at the hospital, and in storage, we have a further 10 ventilators. So a total of 28 ventilators on island in the event that it is needed. Based on our current headcount at the isolation unit, we currently have enough supplies to take care of these patients and to take care of our staff. Because like with any disaster, one of the things we always stress is ensuring that we take care of ourselves before we take care of others. So our staff is well taken care of. They have all the necessary protective equipment to keep them safe from COVID-19. And to date, no healthcare worker who has been taking care of a COVID-19 patient has been tested positive. And this we want to reiterate, and we are very happy to be able to report that. So to date, no one who has been actively taking care of COVID-19 patients has been tested positive for the illness. And for this, we are very, very happy to report. Apart from that, in the hospital services, we have suspended elective surgeries. Now, elective surgeries are surgeries that are planned in advance, and these are the ones that, if not done in a given time, will not cause any harm to the patient. So elective surgeries are suspended until further notice. We will have review within a week or two and then decide when we will start back with our elective cases. So right now we're doing all emergency cases. In terms of our lab services, our lab continues to function as normal. Of course, we're expecting persons coming to access lab service to continue to follow the protocols, wearing of your mask, keeping distance as far as is possible, and keeping your hands clean. Radiology services, we continue to do x-rays for persons who are in hospital, and ultrasound services is extended to persons both in and out of hospital. However, it is done via appointment. Our physiotherapy services, we have suspended outpatient physiotherapy services, but we continue to have our inpatient services until further notice. Our outpatient clinics, given the situation and based on what we've noted as a result of suspending our outpatient clinics in our last outbreak, we decided to continue doing our outpatient clinics to ensure that persons have access to care. However, we're asking persons to cooperate with us in that persons who have to come to the outpatient clinic, we are expecting you to follow the protocols. Wear your mask, keep your hands clean, and try to maintain distance as far as is possible. We also expect that on arrival to the hospital, you should come just 15 minutes before your clinic time. So what we've done was stagger the clinic time so that persons don't all come at 9 and all come at 1 o'clock to avoid a backup of persons within the outpatient area. So we're just asking your cooperation with that and to cooperate with the security in that when you come in, if you come way before your time, you'd be expected to wait outside until your clinic time. So this is in an effort to decrease that amount of persons that normally would crowd at the outpatient area. Our accident and emergency department, right now it's very, very busy. And of course, again, we need your cooperation. So traditionally, at times we want to give support to our family members when they come to seek care. However, in this particular case, due to the outbreak and the number of cases that we have in the community, we are asking our public to please, if you're coming to seek care at the accident and emergency department, please try as best as you can to come with the minimum number of persons possible. So for persons 18 and under, it's allowed for you to come with one extra person to assist. Persons 18 and over, of course, if there's a disability or if you need help or if, of course, you need someone just to accompany you through the ordeal, then I would recommend that, yes, you can be allowed to come with one person. But we are unable to accommodate like entire families at the moment because we're trying to decrease the number of persons who enter our accident and emergency area. Because, of course, our hospital will be a hotspot. We will have patients with COVID-19 in our waiting area. And what we have done to assist in that problem is to divide. So we have one section for everyone with respiratory symptoms or gastroenteritis, fever, body pains, any COVID-like symptom. They're housed in one area of our triage area, whereas the other patients are housed in a different area. So we just want you to cooperate with us and try to come with the least number of persons possible so that we could decrease the number of persons available, present within that accident and emergency department. So I just would like your cooperation. Now, in terms of COVID-19 and treating yourselves, there are a number of persons in self-isolation. Again, how do we maintain ourselves healthy in the midst of COVID-19? One, of course, taking care of yourself. Drink enough water, get enough rest, take your vitamin C, eat your fruits, eat your vegetables, and eat a healthy meal. That's the first step. Number two, in the midst of this pandemic, we can also ensure that we take a top-up on our multivitamins. Our vitamin C and zinc has shown a bit of help in terms of your symptoms with COVID-19. And scientifically, of course, vaccination has shown that it helps to prevent severe illness and also helps to prevent hospitalizations. I know vaccine is a very controversial topic. However, the science speaks for itself. Presently in our hospital and in hospitals throughout the Caribbean, we got data from different islands, Bahamas, Barbados, Jamaica. It's constant. The majority of persons who are hospitalized are persons who are unvaccinated. And right now in Grenada, the same applies. So we just want to reiterate that apart from taking care of yourselves, vaccination also helps to prevent severe illness and hospitalization. We have two options currently. We have Pfizer and we have AstraZeneca. So persons do have an option. So we're asking the public to please try your best to take care of yourselves, boost your immunity with healthy lifestyles, exercise, water, rest, and vitamins, proper meals, and of course your little vitamin supplements. And of course, on the end of the science, we'd encourage persons to be vaccinated. And now we have two options. We have Pfizer and we have AstraZeneca. So, as we say, vaccinate now, it's your best shot. Thank you.
Thank you, Dr. Donald, for that very extensive look at what's happening at the hospital and, of course, the encouragement to the general public, the advice on how persons should take care of themselves, persons who are COVID-19 positive at present, and also to prevent yourself from becoming ill. At this point, we go over to the Minister of Health, Honorable Nicholas Steele. Good morning, Minister.
Good morning, fellow. Let me start by saying my thoughts and prayers go out to the family who recently deceased. We hold them in our thoughts and prayers. The brother of our victim is a close friend of mine. I reached out to him this morning and spoke to him, and we remain available to assist wherever we can. That was one of our lessons learned from our first COVID case investigation, to make sure to be there and give additional support to the family of the victim. And that is what Dr. Donald and myself and the rest of the team intend to do. Dr. Donald has given you the current position with respect to the General Hospital, and Dr. Mariana Charles has given you the current position with respect to COVID cases in the country. Both point to a very serious and grave situation. Both point to we are where we are because this virus does what it does in any and every country. Once it gets out, it does this in every single country. We can expect a doubling of the case rates every 2 to 4 days until we get control of this. We can expect, as a result of that, a doubling of the serious cases, a doubling of the hospitalizations, and regrettably, a doubling of the deaths. We will do everything within our power to prevent that, to delay that, to intervene on that. And that is what we have been doing from the beginning of this, outbreak. But the only way that we are going to get past this completely is by being fully vaccinated as a nation. No country has been able to stave off COVID-19, especially in its current version, this current variant. No country in the world. It is not about closing of borders. It is not about opening of borders. It is not about the type of government, whether democratic, whether left-leaning, right-leaning, whether newly elected, or in government for decades. Monarchies or anarchy. It is about a people coming together and recognizing as a group what needs to be done as a nation. It is about us getting vaccinated. Again, I will say again, it is about us getting vaccinated. We are seeing other nations getting close to life as normal beyond COVID because they are vaccinated. There is not a single example of a nation that is not in dire straits now with low vaccination, because of low vaccination levels. every single country that has a low rate of vaccination is in dire straits. And then areas of countries that have low levels of vaccination find those areas or those states to be in dire straits. And Grenada is and will be no different. So I am pleading with you. We need you all to intervene to stop the spread of this virus. With your intervention, we can do it. And the intervention that we're requesting is that, one, you follow the protocols, and two, you get vaccinated, please. Having said that, I will end the way I began by saying that my thoughts and prayers go out to the family of the recently deceased, and we are open to questions from the media.
Thank you very much, Minister. We do have several members of the media who are present here this morning. We have GBN, Linda Straker, MTV, Nancy Maguire, Nisha Paul, and Mikey Hutchinson. Mikey has indicated that he has questions, so he will start the ball rolling. Mikey, good morning to you. Please go ahead.
I take notice that I haven't seen many of the other media persons saying that they have questions, and maybe we can allude that to the fact that, the quality of information that was provided by the doctors this morning is just commendable. It leaves us in a position where it's even hard to find a question to ask based on what we were told this morning, because it was so explanatory, So, but anyway, I still just need a little clarity. But anyway, again, good job to the doctors. Doctors, how is a COVID-19 death determined? That's one. And I heard about the hospitals and so on mostly are seeing persons that are unvaccinated rather than vaccinated. But I think, based on some of the countries that were mentioned, I think that most speak to the sample rate rather than the efficacy of the vaccines. But that's my humble opinion. So I'd like to have answer to the first question, at least in terms of how it is that we determine a COVID-19 death.
Okay, thank you for that question. Now, to determine a COVID-19 death, first of all, we have to ensure, one, that the person fit the criteria for a confirmed case, which is that the person is positive antigen, symptomatic persons with a positive antigen, a person who is symptomatic or asymptomatic who has a PCR test that is positive, or persons who have symptoms. So first we have to fit that criteria. Now, once you fit the criteria of a confirmed COVID-19 case, we now have to look at the actual clinical picture of that patient in particular. So first, we have to look for signs of, in the case of COVID-19, generally, it would be respiratory issues. So does that person have a confirmed X-ray or not? So if that person has a confirmed X-ray, along with the others, well, of course, confirmation that it is COVID-19, and of course died due to problems with respiratory failure or respiratory insufficiency, then we're able to conclude that this patient in that particular case is confirmed death due to COVID-19. So it goes with the confirmation of case and of course the clinical findings of the patient, the history and the physical examination and the labs to support the claim.
Thank you, Dr. Donald. Mikey, do you have any further questions before we move on?
I have to interfere with my good minister. He owes me a ticket.
What's your question, Mikey? Go ahead.
I said you owe me a ticket.
I owe you a ticket? No, I have a ticket. You want to pay my ticket? Or is it that you want to see it? What is it that you're asking?
No, it's just a light moment, Minister.
I know, I'm there. That's what I'm saying. You want to see it or you want to pay it? Which one?
I'll pay.
No, Mikey, I want to thank you for the compliment you gave to the two goodly doctors here. It is always nice when members of the media recognize members of the team. So I want to thank you for that.
All right, thank you. Mikey, we'll move right along. Nancy Maguire, good morning to you. You may proceed.
Good morning. Thank you. Last week, Minister, you had promised a few more details and breakdown in the data of where the cases are. Can you provide that? Is that not necessary anymore because it's in every single village? I'm just curious about that side of things. Thank you.
Nancy, I think yes to both. We can provide that information, additional information, but also yes, it's basically island-wide.
Well, how will you provide it? You say that, and then if I call, I don't get it. So I'm just wondering how you're going to provide that. Thank
Nancy,
you.
Dr. Mayana Charles is going to present the statistics right now. Dr. Charles?
I would just like to say that we are recording cases in all parishes throughout the island. We are currently at a stage where we have community spread of COVID-19. By that I mean you have persons who have been infected, but with the virus in a particular area, and some persons we do not know from who they contacted it or where they contacted it. So that is the stage we are at right now. And we have cases throughout the island. All right, if you want more specific numbers, I can provide that later on today.
And when you say throughout the island, do you just mean the mainland?
No, we also have cases in Carriacou.
Thank you.
Anything further from you right now, Nancy?
No, that's fine.
Okay, GBN, good morning to you. Please proceed.
Good morning. Rena Pierre Thomas from GBN. I have a couple questions. First off, Dr. Donald, you spoke earlier on about the second death. Could you tell me how long the person was admitted for, and did the test, was her COVID-19 test confirmed through PCR or rapid when they first found out she had COVID-19? Also, the outpatient clinic, I wanted to know if they would be subjected to testing as well. I don't know if Dr. Donald or Minister still be able to answer my third question, but it's relating to the over 200 positive cases. Any of these cases relating to SGU, I understand that there is a lot of COVID-19 testing being done there over the past few days, and they continue to do so. So is any one of the cases, or how many, was connected to SGU?
Thank you for your questions, Rena. Dr. Donald, we'll come to you first.
So the patient was confirmed via first, it was an antigen test that detected it in the first instance, and then confirmed with PCR. So yes, it was both antigen and PCR positive.
How long was she admitted? Do you have that data?
Yes, she was admitted for less than 24 hours.
With respect to the outpatient clinics, are persons there being tested as well?
No, at this moment, no.
Okay.
So we're hoping that persons would adhere to the protocols in terms of mandatory wearing of your face mask properly and keeping your hands clean, and of course maintaining the distance as far as is possible.
Thank you. Minister, you'll take the SGU
Yes,
question.
with respect to SGU has been, as they will continue to do consistent testing. They do testing for us as well as all of their student, as well as all of their student body. So they've been testing on certain days, individuals coming in on flights, as well as, like I said, their student body. We are compiling information right now because as we see that testing as a fair sample, national sample. So what we are looking at is the amount of local students, and all will be tested by a certain date. The percentage of local students that come up positive will give us a fair sample or indication of the percentage of that age group nationally that is positive. So what we need to remember is that SGU is here in Grenada, is part of the community of Grenada, and therefore SGU, like the ministries, like the Royal Grenada Police Force, like even the General Hospital, will have members of their team positive. The difference is that SGU has the ability to and is working with us on testing collectively so that we can get past this. One of the most important parts of this is to identify those who are positive. And so we welcome and thank SGU for that assistance.
Just quickly, I just wanted to ask, was the family of the deceased tested or told to isolate?
Yes, the family was told to isolate.
Okay, moving right on. Linda Straker, good morning. Please go ahead with your questions.
Good morning to you and the panel. I have a number of questions. I'm going to start with Dr. Donald. She mentioned about eating properly and so. When a person is tested positive, can she explain to us what are the necessary steps that that person should follow? In some cases, you are told to isolate. In isolation, what should that person do? While they are with maybe the PCR result, what needs to be done? What happens if they feel worse? What needs to be done? What are the steps that need to be done? My other question is that
Linda, can I interrupt you? Let Dr. Donald address that question, and then we'll take the others from you.
Okay.
Okay. So good morning again. And in terms of what do you do in isolation? So first of all, let me just remind the public that in light of a pandemic, everyone is supposed to have their COVID-19 home plan. So all persons in Grenada, in whichever part of the world, it's important that just as during hurricane season we have a plan, for COVID-19 it's always important also for everyone within the family to have a plan. So when you are asked to isolate, these are some of the things that you need to take into consideration. One, it depends of course on the size of your family and the size of the place you are. But you should try as best as is possible, maintain yourself isolated from the rest of your family members. Meaning that even if you're within the same household, you should try to ensure that you keep your face mask as much as is possible, stay in a separate room, try to keep your hands sanitized as much as is possible. If you have one bathroom, then of course every time you use, you need to sanitize after yourself. And that is to ensure you try to contain it to yourself and not spread to other family members. Two, of course, you have to make sure that you ensure that you maintain yourself healthy. And how do you do that? Making sure that you take enough fluids, make sure you take your multivitamins, because remember, COVID-19 is similar to the flu. So the treatment is more or less the same for the mild cases. So if you're asked to self-isolate and having mild symptoms, is fluids, rest, your vitamins, and fever medication. All right. Now, if you start to present with, let's say, what we call the red flags, so persons who have developed shortness of breath, chest pain, dizziness, or if they begin to feel unwell because of their other underlying conditions, because sometimes it's not just the COVID that's actually causing the problem, but sometimes the combination of the infection with your diabetes or your infection with your hypertension, sometimes your diabetes becomes uncontrolled, sometimes your blood pressure becomes severely elevated. So in these cases, we call these red flags. So these are the type of persons who will need to call for help. So what do? You call the hotline, right? And the hotline has different prompts on it. So for this particular case, once you have a red flag, as I would say, these are the persons that would need to call the hospital, because most likely they will need to go to the hospital for assessment, or the ambulance. We have a designated ambulance for COVID-19 patients. So that ambulance could be sent out to pick that patient up, and that patient will be assessed and decide whether you need to be admitted or not. All right. And of course, your admission would be dependent on, of course, your vital signs, because even if you're COVID-19 positive, they would assess you, they would check your vital signs. Sometimes you need just a bit of hydration. And based on the assessment they come up with, then they would decide if you need to be hospitalized or if you can return home after certain interventions. So I hope I answered your question.
Thank you, Dr. Donald. Linda, you may go ahead.
Yes, I think answer the question so I could understand. I hope others out there who have been asking that question do understand what are the steps. My other questions has to do also with if a person is admitted to hospital, what are the medication lineup that Grenada is using? Because you did mention people have heart, diabetes, hypertension. Are there any specific COVID treatment that will be administered? We are hearing of different drugs, hydroxychloroquine and so forth. Is there any indication that persons who have been administered to the hospital who were put in isolation have taken any of those drugs without doctor's consent or doctor's knowledge? Is there any indication for that? And in the case of the person who died, was any specific drug administered to her during her less than 24 hours administered at the hospital? I do have others, but I guess you will want to answer that single.
Okay. So yes, the treatment protocol that we use at the General Hospital is vitamin C, zinc, dexamethasone for persons with respiratory compromise. We do use hydroxychloroquine on consent from the family. And of course, we cover for community-acquired pneumonia, which is a combination of ceftriaxone and azithromycin or augmentin and azithromycin. So that's the treatment protocol we use for COVID-19. And of course, you treat the person's underlying condition. So if the person is diabetic, then you use your necessary drugs for diabetes. If they're hypertensive, you use the drugs for hypertension. So the COVID one I gave, and of course, any associated comorbidity is treated as well. Of course, if the patient needs oxygen therapy, then we do high flow oxygen therapy as well.
My other question had to do with evidence of persons who were in isolation ending up in a hospital using any one of those drugs without doctor's permission, knowledge, or guidance. And where we are at, my other question had to be follow-up with that. What is the obligation of a private doctor who would have diagnosed a person with COVID? What is the obligation of the doctor to the Ministry of Health as well as to the patient? Can they tell a patient, well, you have you're positive, but here what you can use? What is the obligation? Because from indication, it appears that a lot of people are going to private doctors where they get an antigen test and they're positive and are being given regimens to go back home. When that happens, what is the obligation of the doctor as well to the ministry and the doctor to the patient?
Yeah, Linda, all licensed doctors in Grenada, all, whether private or public, are obligated to report a positive or suspected positive case to the chief medical officer. They are obligated.
And if there is evidence that they failed to do that?
And it is an issue that the chief medical officer and I would think the licensing authority, the Grenada Medical and Dental Council, would take up disciplinary action against that individual for complete breach of professionalism.
My other question has to do with the use of the drugs that have been used for deworming and so. Is there any evidence that person are using those drugs without the doctor knowing? They're probably going to buy themselves and so. Any evidence so far from persons who are hospitalized? I said it against the background of pharmacies confirming that there has been an uptake of people inquiring and purchasing. They don't know if it's for animals or humans.
Okay. So as far as I'm aware, the persons who are hospitalized, we have not administered ivermectin to them, and I cannot say if they have been taking it by themselves. But as far as we are aware, we have not prescribed ivermectin to anyone thus far.
Thank you, Dr. Donnell. We move right along now. Nisha Paul, please go ahead. Good morning to you.
Good morning to everyone. All right, I have a couple of questions. Can someone explain what is meant by when you say that we have recovered cases? Does that mean that the immune system completely destroyed all of the virus and the person is no longer infected? And what was used to aid in the recovery? Also, what are the guidelines used to determine that a person is officially considered recovered? And from the number of recovered persons, how many have been vaccinated? And can you provide a breakdown for the different COVID-19 variants that are confirmed on the island? Thank you.
Thank you for your questions, Nisha. Dr. Charles?
Now, for persons, I'd like to start off with a case, right? For a person to be considered as a confirmed case of COVID-19, currently, if the person is symptomatic and they have a positive rapid antigen test, they're counted as a case. If they have a positive PCR, be it symptomatic or asymptomatic, they are counted as a case. If that individual also is asymptomatic with a positive rapid antigen test and has been in contact with a suspected or confirmed case, they are counted as a case, right? Now, in terms of persons who have recovered, right, it means that that person would have been infected with COVID-19, confirmed as a case, right? And prior to now, what we use is the testing, right? So prior to now, we tested persons with the PCR test. If that after 7 or on day 7 and day 14, right? When they cleared it, we determine them as clearing the infection when that PCR test is now negative, right? So that is what we used previously to determine recovery. To date, and where we are now with community spread, persons confirmed as a case are advised to isolate for 14 days. After the 14 days, they are considered as recovered. And this protocol is similar to other countries and internationally, right, in the context of community spread. Right? So currently, this is what is counted as a recovered case. Sorry, let's just add, as it relates to the vaccine status of the persons who have recovered. I do not have the data with me presently, but again, I can tabulate that and we can share it with the general public.
Thank you, Dr. Charles. Mikey, we come back to you for follow-up.
Yes, well, I just want to go back to Dr. Charles just a bit to get some clarity on what's confirmed as a positive case. Did she say that persons who have been in contact with a positive case and show a positive result on an antigen test is considered positive for COVID-19?
Correct, right? So I'll go over it again, right? We have different ways that we can confirm a case, right? There are two types of tests we are using here in Grenada. We have the PCR test, which basically detects the virus, right? And we have the rapid antigen test, which detects proteins produced by the virus. So these are the two tests we can use to confirm COVID-19. Now, as it relates to PCR tests, if a person is symptomatic or asymptomatic and they have a positive PCR test, they are considered as a case, right? Now let's move on to the antigen test. A symptomatic person with a positive rapid antigen test is counted as a confirmed case of COVID-19. Additionally, an asymptomatic person with a positive rapid antigen test who have been in contact with a confirmed case or a suspected case is also counted as a confirmed case of COVID-19. I hope this clarifies everything, Mikey.
Okay, well, we need to go a little deeper into that. When did that method change from moving directly from a PCR test to this method that you just explained?
Okay, right? So good question, right? Where are we right now? Currently, Grenada is at a stage where we have community spread of COVID-19. By that I mean you have cases in the community and persons do not know, for instance, where or whom they got it from, right? So since we have confirmed community spread, we have started using this method. And this method is not unique to Grenada again. This method is even recommended by WHO and is also being used in other countries throughout the region to detect positive cases in the context of community spread.
Okay, and final follow-up to that particular answer. Can you tell me what is the margin of error for that method versus the PCR method?
It's a good question, Mikey. Again, PCR test, right, is the most sensitive test for detecting COVID-19. Why is that so? Because it detects the actual virus, right? Now, antigen tests detect proteins produced by the virus. Now, in cases where persons are symptomatic and they have a positive antigen test, that test is highly sensitive to pick up the disease, and it is also very specific for COVID-19. Now, the sensitivity, meaning how readily will it detect a positive case, drops when the person is asymptomatic. That is why we have the additional aspect of it. If you're asymptomatic with a positive antigen and you're a known contact of a confirmed or suspected case, right, and that is a direct contact, then you're also counted as a case. I hope that answered your question.
Please forgive me. Please forgive me. Now,
Mikey, this is the final one because we have 3 others who are waiting with questions, okay?
But I'm just asking for clarity on behalf of the public. I think that's the purpose of us being here. I do not want the public to go with their questions unanswered. And while the answers are coming, I think we need further clarity on some of those answers. And that's why I'm asking on behalf of the people. But if we have to move on, fine. I'll ask this final one. Now, can other viruses, and we know that, for example, in August, we have other viruses that are prominent all the time. Can other viruses present or cause one to present with a positive antigen test?
Okay, so Mikey, that is again a good question. Now, I would say, right, now that antigen test, right, it is specific for COVID-19 in that it detects the protein produced by SARS-CoV-2, which is the virus that causes COVID-19. Now, as it relates to other viruses, right, they will produce different proteins, and those proteins will not be detected by a COVID-19 rapid antigen test. That test is specific for COVID-19. Now, as it relates to antigen tests, the main concern for antigen tests is what we call false negatives. By that I mean we have persons who are asymptomatic. They've been in contact with a positive case or a suspected case, and the antigen test come back negative. This is our concern, right? Because again, the sensitivity of that test, meaning its ability to detect a positive case when persons are not experiencing symptoms, is lower, right? And with that in mind, right, our recommendation that for these persons, they still are required to quarantine for a period of 14 days. And we retest them. We do 2 tests for them. Antigen test on day 7 and on day 14. Just in the event that we missed on day 7, and that was a false negative, we will be able to pick it up on day 14. Okay,
Mikey, before we move on to the next individual, I think you have made it obvious to us that we're going to release some PSAs, public service announcements today, specific on the testing protocol and the change of testing protocol, and also to debunk any myth out there or belief out there that it is possible to test positive with a different kind of flu or virus or so. So we'll release those, and so thank you for raising those.
Okay, we will move along. Mikey, I do appreciate the follow, but we also have to be mindful that there are others in waiting. So right now, I think we go to Nancy Maguire. You had follow-up questions? And
Yes,
then I have
do.
a question from MTV. Go ahead, Nancy.
Thank you. Some of the cases that we discovered were people when they were departing Grenada. Have we discovered any more of those? And what happens to those people? Do they get stuck in quarantine, or do they carry on to their homeland? What happens to them? And my second question is, for persons that are not vaccinated, what if you go to get vaccinated and you already have COVID? Thank you.
I will just address the first question. Now, as it relates to detecting more cases in persons departing Grenada, we haven't since the last update. Additionally, each country have their own travel requirements. For all countries, persons cannot travel with a positive result. So those persons will have to isolate in Grenada until we count them as recovered from COVID-19. They will not be able to travel with a positive test result.
I do have a question here from MTV. She's having some audio challenges. But she's asking, is there a specific time for the PCR test to be conducted after exposure?
So again, this is a good question, and I'm going to take you back to the beginning, right? The incubation period for the virus, which is SARS-CoV-2, the virus that causes COVID-19, is 2 to 14 days, right? And by that I mean, and the average day for it to be detected on a swab is between day 5 to 7. So again, we do not test people prematurely. We test people between day 5 and 7 after exposure to a confirmed or suspected case, right? With that in mind.
Thank you, Dr. Charles. And then there was a follow-up from Nisha Paul with respect to the breakdown of COVID-19 variants on island. Do we have those statistics, or would we have to tabulate and provide later?
What was the question? Sorry, I missed it.
She was asking for the breakdown of confirmed COVID-19 variants. So, like, how many cases of Delta? We probably have Alpha.
We are awaiting our last set. We send on a regular basis. But for this last outbreak, yeah, it's Delta. So we haven't had any other variant, and that's what's going to follow. Like anywhere else, when you see on the news that Delta variant is the most dominant. So right now the assumption is, but we confirm that with tests from CAFA, the assumption is that if it shows up, it is the most dominant one.
Okay. Thank you very much, Minister. GBN, I'm sorry that I missed you in the line of follow-ups, but you can go ahead now. Rena, go right ahead.
Hi, I have 3 questions. 2 to the doctors. The first one is, can a person who would have recovered from COVID-19 take the vaccine afterwards, and how soon after they would be able to take the vaccine? Members of the public, could you clarify if there is a common cold going around, and if so, how can persons identify the difference between the common cold and COVID-19, symptoms of COVID-19? Because there are people who may be home that have certain symptoms but think it's the cold. So how can they differentiate between that, or do they have to take a test to do so? And my final question is regarding sometime last week, Friday, I believe over the weekend, one individual who would have been, or who works at the bus terminal would have had some symptoms relating to COVID-19. I believe that they tried to contact the hotline and they did get through after about a few hours, and they were told to stay home. The person do have a very young baby in the house and they're home, but no one presently, based on the last contact I had, came to them. I want to know if the ministry is aware of this case and if anyone within the bus terminal as workers were tested, because that person said that on that said they did go to work and they have been going to work for the past few weeks.
Thank you for your questions, Rena. We'll start with Dr. Charles.
Now, as it relates to being vaccinated after recovering from the infection, this is recommended by the World Health Organization, by CDC, by many government bodies. So it is recommended to get vaccinated after infection with the actual virus. And the current recommendation here, we are recommending 1 month after infection, 1 month after recovery, to get vaccinated. Again, research has not yet shown how long you are protected from COVID-19 after being infected with the virus. Right? So what do I mean by that? Research have not yet shown how long natural immunity lasts. Natural immunity is immunity protection you develop after you are exposed to the actual virus. Right? Research has not yet shown that, and for these reasons, we encourage persons to get vaccinated. My second point to that, vaccination offers protection against many different variants of the virus. Right? Now, it could be sometimes that persons can be infected with one strain of the virus and then get reinfected with another strain, right? Because the protection they develop from getting infected the first time around would not protect them from another strain. So again, it is encouraged that all persons who have recovered to get vaccinated, because vaccination will protect you from many different strains of the virus.
And to answer your second question, now COVID-19 and the flu can present the same way. They both can present with fever, body aches, muscle pain. You could have vomiting, you could have diarrhea. So basically, they present the same way. And yes, during this time of the year, we're actually going into flu season. So we will have a combination of COVID-19 and flu circulating, which means that in order to determine whether it's one or the other, you will have to get tested. And in light of the testing, because we're now in community spread and we've identified the need for, mass testing of our population, we have now decided that it would be helpful to set up pop-up testing sites throughout Grenada, Carriacou, and Petit Martinique. So during the course of this week, we're working towards setting up testing sites, at least one in each parish, so that we can ensure that persons have they have access to easy testing. Mm-hmm.
Okay, thank you very much. I think
My
that's
question was not answered regarding the situation with the bus terminus.
I don't think we have any record of persons being tested at the bus terminus, but I would not be surprised if in our batch of persons that either pending results or results that have gone out would include employees of the bus terminus. We're more, in terms of the identification, yes, where the person works is part of the record, but the majority of the focus, as has been your questions, is which area of the country the person lives, because that's where they're going to isolate as well. So both of those details are collected, but we're not aware of bus terminus specifically. That doesn't mean, though, that there haven't been persons on our list from who are employees of the bus terminus.
Thank you very much, Minister. We'll enter our wrap-up phase now. It's now 10 minutes after 11. Dr. Charles, I will start with you, maybe circle back to where we began. Brief overview of the figures, the statistics as to where we are, and any other closing thoughts or comments you may have at this time.
Right now, as I would say, we are here right now. All right, we are at 461 confirmed cases, 267 active cases, of which 257 are local. We are at a place of community spread, right? So we are at a very significant place. I want to appeal to the general public. Do not panic, all right? I don't want persons to panic. If you develop symptoms or you think you may be exposed to a possible case of COVID-19, please self-isolate, right? Do not go to work. Do not go to any public gathering or anything like that. Call the hotline or your health center and arrange for testing so that we can limit the spread of the virus. Again, the virus moves with people, right? So when we're moving about, we need to practice the prevention methods. And I want to remind persons of those measures, right? Wear a face mask to cover your nose and your mouth while away from home or in public spaces, right? And I'll add a second point to that. Even if you're at home and you live in a household where you have been exposed to a case, right? So you're counted as a direct contact of a case, but other members in your household have not been exposed to that case. I would also encourage you to wear your mask at home to protect your other family members, right? Even in the household, if you cannot properly self-isolate in that household. Additionally, from the beginning, wash your hands often with soap or water, or use a hand sanitizer with 70% alcohol or more. Maintain a distance of 6 feet or 2 meters, right, from persons. Again, avoid crowded spaces. Avoid confined and enclosed spaces. Clean and disinfect regularly, right? So these are what I want to encourage the general public. And finally, I want to encourage persons to go out there and get vaccinated. Remember, vaccination protects you from hospitalization, death, and severe illness. And that is quite significant. Now, you have two options. You have Pfizer and you have AstraZeneca. So go out there and protect yourself from actually contracting the virus. All right, thank you.
Thank you, Dr. Charles. Dr. Donald, right over to you. Your closing thoughts or comments?
Yes, so I just want to remind persons that of all of our hospitalized cases, they all had underlying conditions. And it says that it speaks to the fact that persons with underlying conditions are persons who are at risk. All of the cases who are also admitted the majority of them are also unvaccinated. So again, based on our data, it shows that persons with underlying conditions who are unvaccinated are at risk for hospitalization and becoming critically ill. Now, we want to say again, persons need to have a COVID-19 home plan. Each and every home must have a plan for what do I do in the event of COVID-19 exposure or being tested positive for COVID-19. 2, self-care. We need to take care of ourselves. We need to do our annual checkups. We need to eat our fruits. We need to eat our vegetables. We need to drink our water. We need to exercise, and we need to get enough rest. In the light of the pandemic right now, we need to top up also on our multivitamins, our vitamin C, our zinc, and general multivitamins based on your age group. And 3, of course, remember that scientifically, the only thing that we have at hand presently that can help decrease severe illness and hospitalizations, as we have seen in the cases that we have hospitalized, is vaccination and, of course, taking care of your underlying conditions. So please, we urge the public, there are a lot of persons out there with chronic illnesses, we urge the public to please get yourself checked, get yourselves vaccinated, and of course practice self-care and follow the protocols. Thank you.
Thank you, Dr. Donnell. And Minister, the final words
Yes,
are
thank
yours
you.
this morning.
Thank you, Philomena. And first off, let me thank the goodly doctors for their excellent presentation today. And to say that, as Dr. Charles has said, it's not a time to panic. It is a time to take this very seriously. But there is a difference between panicking and taking this seriously. What is happening here in Grenada now is science-based. It is what has happened in other countries. What makes a difference in how we deal with it as a people is whether we make rational decisions or whether we make emotional decisions. All of us. So I want to say that you will see the number of cases quite likely increasing, further significant increases in the number of positive cases. We will continue to monitor with these doctors, Dr. Donnell at the hospital daily, sometimes twice, 3 times a day, giving updates on the status there, as well as with Dr. Charles and our CMO, both Dr. Charles and that team, on the daily positivity rate and number of cases. And from that information, we will make the various decisions with respect to adjustments, if necessary, that may or may not be needed. So I ask the population to monitor with us, look for the updates from us, and from those updates, we will also be seeing what the necessary or relevant action to be taken may or may not be. To remain calm, to recognize that COVID is among us, that your nearest friend, closest friend, or the next person you interact with could be that positive case. And as such, we act accordingly. And that is the second most important thing you can do to help us stop the spread of COVID-19. The first most important thing you can do, as they have all said, and I have to say as well, is to get vaccinated. So I want to thank the members of the media for their questions, and most of them were very pertinent, very relevant questions that allowed the doctors to share additional information and continue to work with us to help us. You play a very important role in getting us out of this pandemic as well, by making sure that you separate disinformation from information and therefore we welcome the opportunity to be here to give you the information. Thank you.
Thank you very much, Minister. And this is where we put a wrap on things for this morning. For quite a long time here in Grenada, we were almost like spectators to this pandemic, looking at what is happening in other countries. But the reality of the pandemic has finally hit home. As you've heard from the doctors, we now have community spread. It is a serious situation, it is a dire situation, but all is not lost. We all have to now, more than ever, engage in personal responsibility, follow the recommended protocols and the necessary guidance by the health professionals, and we will get through this. That's the plea to one and all, and also to get vaccinated. I thank you for joining us this morning. To members of the media, thank you as well for tuning in week after week and helping us to get the message out. To members of the listening and viewing public, I hope that you have gotten a wealth of information here this morning, and continue to tune in to the official and reliable and credible sources of information. I am Press Secretary Philomena Robertson. Thank you so much, and we'll see you next time.